Hello everyone, we are representing Group G to present the median nerve examination. Firstly, the student need to introduce and ask the patient's permission to conduct the examination. The student also need to make sure there is adequate exposure of the arm to examine. So, we will start the examination with look. For look, find any muscle wasting of the volar forearm and thenar muscles as they are mainly supplied by the branches of median nerve. Then, look for any swelling at the cubital fossa. You should also look for any visible scars at the wrist, forearm and also arm. Then you should also look for any deformity such as Dinner's fork deformity in case of Colles fracture that may have injured the median nerve. Other than that, you should also look for finger cascade and simian hand. Patient with simian hand and thenar wasting usually presents with low median nerve palsy from the lesion at the wrist area, while in high median nerve palsy, the patient usually presents with loss of normal finger cascade and volar forearm wasting that give the clue about the site of the lesion either at the elbow or forearm area. After look, we will move to feel. In this physical examination, we should check for the temperature and tenderness of the hand. Followed by screening test. We will ask the patient to elicit OK sign. So, if there is a high median nerve lesion, it can be elicited by testing for OK sign. If the patient is unable to do OK sign, means he could not flex the index finger and thumb. This is a sign of anterior interosseous, a motor branch of median nerve problem. After screening test, we move on to the motor examination. The motor examination is done to check the range of motion of the hand, wrist and fingers. During the motor examination, it is important to check the flexion and opposition of the thumb, flexion of the wrist, flexion of the second and third digits at the metacarpophalangeal, proximal interphalangeal joints and distal interphalangeal joints and pronation of the forearm to elicit any impairment of median nerve. This is due to median nerve supplies the flexor and pronator muscles in the anterior forearm, and it also supplies the thenar muscle and the lateral two lumbricals. Next is the sensory examination. The examiner will apply pressure on the palm and fingers using an orange stick, while the patient have to answer yes or no with their eyes closed. If the patient complained of loss of sensation at the palmar surface of the thumb, index finger and middle finger, it means that the palmar digital branch of the median nerve is affected. If the patient feel loss of sensation at the thenar eminence, it means that palmar cutaneous branch of median nerve is affected. Lastly, two special tests are done to rule out the carpal tunnel syndrome. The first test is Tinel's test, where the examiner will tap at the area in the middle of the wrist. If the patient feels tingling or paresthesia, the test turns out to be positive. While the second test is Phalen's test, where the patient is asked to flex the wrist for 1 minute, which may exacerbate the pain if the test is positive. With that, we end the examination. Thank you.